Opioid overdose deaths have hit an all-time high in the U.S., and that includes right here in the Kansas City metro. So states like Missouri have recently launched a dashboard like this one here to track the opioid crisis. And you can see year over year, it's becoming a bigger problem. And experts we talked to today say the pandemic did not help.
The graph tells a story, staggering numbers showing the growing opioid epidemic. According to the CDC, last year in the U.S., there were more than 107,000 drug overdose deaths.
So our local numbers in the states of Missouri and Kansas reflect that as well.
Dr. Jeff Foster is an interventional pain specialist with St. Luke's Health System. He says opioid overuse is the leading cause of death among people 18 to 44 years old.
The number one cause is illicit substances like fentanyl. Sometimes those are additionally cocaine or methamphetamines, but also prescription opioids that are being misused.
Dr. Foster says the COVID pandemic has also contributed to the crisis.
Experts believe that that is contributing to our worsening mental health, which can also contribute to seeking medications like opioids to help control pain.
Foster says pain can be debilitating, but taking long-term opioids can be dangerous.
There are many risks to a person's health, including worsened cardiovascular risk, the risk for heart attacks, risk for osteoporosis, and changes in endocrine systems with hormonal changes.
Not to mention impacts to your immunity, including poor gut, dental, and mental health. Dr. Foster encourages patients to talk to their physicians about alternatives.
Some of those treatments can include things like epidural steroid injections or radiofrequency ablations. There are even specific treatments for discs and for stenosis.
And he says there are even ways to control pain without medical intervention.
Those can be things as conservative as daily exercise and working with physical therapy, doing yoga and Pilates.
And Foster says if you or a loved one is on pain medication and you begin noticing changes in behavior like withdrawing from family or community, it may be time to seek a pain intervention specialist.